Good morning, everyone. As a preliminary matter, this is Stephen Vigent, Chairman for the Board of Health. Please permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dr. George Abraham.
Present.
Jenny Fishman.
Here.
Staff, when I call your name, please respond in the affirmative. Kerry Stockwell.
Here. Affirmative.
Anticipated speakers on the agenda, please respond in the affirmative. Micah Blondeau. Is Micah still on?
I believe
Okay,
he is. Maybe he's having trouble with audio.
Okay, Karen Clark.
I'm here. I'm sorry. I was stuck on mute.
Thank you. Karen Clark. She may not be on just yet. Julie Van Arsdalen.
I'm here.
Great, thank you. Good morning. This open meeting of the Shrewsbury Board of Health is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. For this meeting, the Shrewsbury Board of Health is convening by remote participation with a call-in number of 617-675-4444 and a PIN number of 549-885-230-0117 as posted on the town's website, identifying how the public may join. We are now turning to the first item on the agenda, but before we do so, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I, Stephen Vigent, the chair, will introduce each board member or staff member who has a lead role for this particular item or guest speaker associated with this item on the agenda. After they conclude their remarks, the chair will go down the line of members first and then to staff members, inviting each by name to provide any comment or questions. I will then call upon the members to offer a motion and then for a second. Please hold until your name is called. Further, please remember to mute your phone or computer when you are not speaking. Remember that unless a document is being shared, your camera feed is triggered by your speaking or background noise. To mute or unmute your telephone, dial *6. Please remember to speak clearly and in a way that helps generate accurate minutes. If members wish to engage in colloquy with other members, please do so through the chair, taking care to identify yourself. Finally, each vote taken in this meeting will be conducted by roll call vote. The next meeting of the Board of Health will be held on Friday, December 18th, 2020 at 8 a.m. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 20A, Section 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Shrewsbury Board of Health will be conducted via remote participation to the greatest extent possible. To participate in the public comment portion of this public meeting, please dial 1-617-675-4444 and enter the following PIN: 549-885-230-0117 #. Please mute your device until the chair of the board addresses this agenda item or opens the meeting to public comment. The meeting is now called to order. The first item on the agenda is the review and approval of the minutes from the November 20th, 2020 Board of Health meeting. Has the board had a chance to review the meeting minutes?
Yes, Mr. Chair, motion to approve.
I second.
Okay, all in favor signify by saying aye. Dr. Abraham,
Aye.
Jenny Fishman,
Aye.
Steve Vincent, aye. The meeting minutes are approved. The next item is to review and act on revising local body art regulations. This is something that we have discussed for the past couple of meetings in terms of updating the Shrewsbury Board of Health body art regulations that are in need of revision. And the board has reviewed the proposed revisions based on another town's regulations. And the thought now is to go ahead with a public hearing on the revised regulations. Would the board like to, or is the board interested in holding a public hearing at the January meeting of the Board of Health?
Yes.
Jenny Fishman? Okay, so the board will go ahead and conduct a public hearing concurrent with the next, or the January Board of Health meeting. Unless there are other comments on that topic, we will move on to the next item on the agenda. Okay, the next item is to review and discuss coronavirus COVID-19 update. I guess, is Karen Clark on the phone?
I am. Good morning, Mr. Chairman. How are you?
Good, how are you?
Good. Good morning, everybody. So I'll just give a very quick update, which is obviously the numbers are skyrocketing. Last week, Worcester and Shrewsbury went into red, which is under the new metrics that the state had come out with. In fact, last night I was looking at the map of Massachusetts on the news, and there's a lot of red and a lot of yellow. So not surprising. The numbers are really high. In fact, I think, and Kerry, correct me if I'm wrong if you remember, but I think Shrewsbury had 47 new cases yesterday. Does that sound right?
Yep.
So this is, what we're seeing across the alliance. Worcester obviously having the highest. In fact, yesterday I think we had 281 new cases, followed by Shrewsbury at 47. But all across the alliance that we're tracking, the numbers are high. So we're still seeing a lot of spread happening within families that live in the same household, but I think we're also still seeing the surge created by Thanksgiving. So we have a lot of concerns about, and I know Governor Baker also talked about this too at different press conferences, just a lot of concern about, the holidays going into New Year's with people gathering. So really trying to get people to heed the warning that you just really have to be careful and just try to celebrate with whoever is in your quote bubble, and just sort of have these smaller gatherings with your immediate family, because the community spread factor is just enormous with people shopping and gathering. So we're definitely concerned about the numbers. And obviously we are very excited to hear about vaccine coming online. We are now, it sounds like the Moderna vaccine is ready to roll, which is really great. Mass DPH has inquired with local public health if we have the capacity to potentially stand up some emergency dispensing sites. They're calling them super EDSs to vaccinate sooner rather than later first responders. So we're having conversations in Worcester with our emergency management team and with the city manager's office about how would we do that, how we would be able to extend that to the Alliance first responders. So we're right now just trying to gauge that, and also, we're talking about as early as January 4th or January 11th when the Moderna vaccine would be delivered. And as you can imagine, this is not just like running a typical flu clinic or even as an EDS drill that we've done many times in the past. Being that this is a new vaccine, there's a lot more paperwork, questions. Obviously, we would want to monitor folks probably, well, it's 15 minutes, but if someone has allergies, you watch them for 30 minutes. And then, of course, there's a second vaccine that needs to be had. So we really want to do it. We certainly have enough volunteers, but to coordinate that and be ready, say, for January 4th, we're just trying to still determine our capacity to do that and how many days of an emergency dispensing site we would do, et cetera. And then the other piece on vaccine I would just share is, obviously, I'm sure you've all seen the photos and on the news about frontline workers receiving vaccines. It's been really awesome to see that happening at UMass. I also know that long-term care facilities are coming online. Connecticut and 2 other states, Walgreens is already ramping up to go to long-term care facilities and give them their vaccines. This is going to continue to ramp up with Walgreens and CVS. Obviously, our long-term care facilities have been hit hard by COVID, so that's good news to see that that's coming online as well. So lots of moving parts. Awesome to see vaccine, but obviously we're still in the middle of this, so we really have to remain vigilant and continue to adhere to the 3 W's and just do what we can to be safe during the holiday season and until we can get everybody vaccinated.
Okay, thank you. Either Karen or George, do you know how the hospital capacity issue is doing right now?
Yes, I'm happy to speak about St. Vincent Hospital. So first of all, we started our vaccination yesterday. I was among the first to get the vaccine, and I think the front page of the TV here is our respiratory therapist who we selected to get the vaccine. Yesterday, I was tasked with standing up the vaccine clinics, and so yesterday we immunized about 240 healthcare workers. And today morning, it's been in progress since 6:30 this morning. So by tomorrow evening, we would have finished 975 doses our first round, and we expect another 975 more on Sunday for our next round. But our capacity, so we are running about 50 to 55 people in-house. UMass is running about 70 to 75 people in-house. The field hospital at the DCU Center has about 20 to 25 people at there. They've taken care of about 75 people over the last couple of weeks. Our ICU capacity is pretty decent. So is at UMass. We have about 10 to 12 people in the ICU, the rest of the people on the floors. So we are not overwhelmed. Fortunately, Massachusetts as a state has not been overwhelmed in terms of hospital resources. We are managing pretty well. We have scaled back some degree of elective procedures, doing only those that are considered essential per the governor's orders, so as to be able to maintain capacity. Our biggest challenge is not PPE, as was in the first surge, it's personnel. As Karen alluded to, the clusters and outbreaks in the community have affected the healthcare workforce as well, and a lot of our staff have fallen ill because either spouses or family members or parents, or they've had some contact with people in the community in some form of a closed setting, which has led to their being infected. we have doubled the number of staff who have gotten infected in the last 2 months than we did over the last 8 months of our pandemic, the preceding 8 months. So it just goes to show that the clustering, and part of the reason for the clustering is obviously people being indoors because of the cold weather, and partly because the virus that we have in the US is a mutation of the original Wuhan virus. There's a mutation at the 614th position, which confers increased efficacy of transmission and increased efficacy of spread without an increase in resistance whatsoever. So we believe that that's also partly the reason why the prevalence in about March and April was about 5% of the mutation. Now it's 98 to 100%. So, which is also why we postulate that the spread has been so efficient and has been so exponential in the last month and a half. But our healthcare resources continue to be carefully monitored, especially personnel, because every person that goes out means that's 10 days that that person is out. And so this can quickly mount. So we are carefully monitoring that. We have things under control, and I'm constantly in touch on a weekly basis with Dr. Michael Hirsch and members from UMass, and we have a coordinated call every Wednesday where we confer about resources, challenges, vaccinations. We talk with the community health centers. So the city is managing pretty well, and grateful to everyone in the city, including Karen and others who continue to help coordinate between all the various healthcare settings in the city.
Okay, thank you, Dr. Adrian. That was a wonderful update. Thank you so much. Is there any other questions in this regard? Jenny Fishman?
Nope, I'm all set.
Okay, so let's move on to the next agenda item, which is review and act on the report from the Central Massachusetts Regional Public Health Alliance. I don't know if Karen or Julie, if you're going to address this, or
Julie, do you want to provide any updates? I mean, I know everybody has it, so I always like to just ask. I think more if people have questions, because I don't want to read what you already have there. But also, I know it's an opportunity for Micah and Julie to just talk about work that's happening in the town around environmental health as well.
I can give my update as far as inspections and complaints and things like that go.
Sure, go ahead.
Sure. Since the last meeting, we've done 42 inspections, regular inspections with only 2 re-inspections. We've also had a steady flow of complaints. Most of them are coronavirus related, usually a mask complaint. And if it's at a food establishment, I do follow up in person on those. Other mask complaints kind of depends on the situation. And if we do get a situation where someone's obviously not complying, we will issue a citation for that.
So I just want to give you an update. I did issue a citation, a violation, or a ticket for UPS. I did fine them $600. I believe that was last week. Due to the copious amount of complaints that have been coming through, I made a site visit as well as I talked to Department of Labor Standards regarding the situation there. They seem to have everything posted. They seem to be trying to do everything the right way, and it's just a few defiant workers that are causing more of an uproar. And then also, I just wanted to let you know that as far as Title V goes, I've been out doing system inspections. Everybody's trying to button up everything for the winter. So hopefully that piece will start slowing down.
Okay, great, thank you. Just a quick question: How has the compliance been relative to the food inspections, Mike? Is pretty much just about everybody is in compliance with the requirements?
Yes, I definitely make sure they're taking all their COVID compliance steps, and I really have not had any issues with restaurants other than the occasional staff member not properly wearing a mask, or maybe taking their mask off, being spotted by someone. So otherwise, they've been doing very well. I feel like the restaurants have they've had a lot less traffic, so they have a lot more time to clean and organize, and it's kind of made a difference there for them.
Okay, are there any other questions for Julie and Micah from the board? Jenny Fishman?
Nope, all set. Thank you for everything you're doing. I'm sure you've been busy.
Yes. So, George Abraham?
No further questions, thank you.
Okay, well, thank you, Julie and Micah, so much for everything you're doing to for your continued inspections, and keep up the good work.
Thank you.
Thank you.
Okay. Okay, the next item on the agenda is to review the meeting schedule. And in this regard, I want to draw the board's attention to an email from, under the reference material on the agenda, an email from Brian Moss, 16 Lutheran Circle, Shrewsbury, dated December 20th, 2020, in regard to a request to be put on a Board of Health agenda in regard to more recent information studies in regard to the effects of fluoride on cognitive health and development. Is the board interested in adding Mr. Moss to a future agenda?
Mr. Chair, if we are doing the other regulation discussion in January, then I would suggest we move it to a February meeting.
Okay, but you would be in favor of putting it on an agenda?
At this point in time, I'm not sure what more, but I think the citizen is entitled to provide his additional opinion, so I'm willing to hear him out.
Okay, Jenny Fishman?
Yes, I would agree.
Yeah, I would agree that it's incumbent upon us to allow any new. We've discussed this topic many times before, but to allow Mr. Moss the opportunity to present the new information at a future meeting. So at this point in time, if the board agrees to add it to the February meeting because of the public meeting that we're scheduling on the Body Art regulation at the next meeting, which I would propose to be January 22nd at 8 a.m.
January 22nd. Okay.
That works for me.
I apologize. I have a lecture to give for UMass trainees because I anticipated it might be the 15th. And so 22nd, I'm committed. So unfortunately, I can't do the 22nd. I could do the 29th or the 15th if either of those dates work.
Okay. Does the 29th work for you, Jenny?
Yes, it does.
I can do the 29th as well.
Okay, so let's plan on scheduling the next regular Board of Health meeting at 8 a.m. January 29th, and concurrent with a public hearing on revising the local body art regulations.
I have that on my calendar. Thank you.
Okay. So at this point, do I have a motion to adjourn?
So moved.
I second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Steve Vigent, aye. Thank you very much. Very safe and happy holidays, everyone, and this meeting is adjourned.
Likewise. Thank you.
Happy holidays, folks. Thank you.
Thank you.
Thank you. Happy holidays.
Bye-bye.